Welcome to our deep dive. We're tackling medical billing and coding this time. It's one of those things, everyone knows it's important, but so many people find it confusing. You've given us a ton of material on it.
Yeah, it can be a bit of a rabbit hole.
So, let's see if we can make sense of it all.
Sounds good. It's a crucial part of healthcare, that's for sure. From a simple checkup to a complex surgery, pretty much everything goes through this system of codes and bills.
Right. And to start, I'm seeing these three main code sets mentioned everywhere. CPT, ICD-10, and HCPCS Level 2. What are they all about?
Well, they're basically the language of healthcare billing. They translate all those medical procedures and diagnoses into something insurance companies can understand and use to process claims.
Okay, so like a universal language.
Exactly. Take CPT codes, for example. They focus on what actually happened during the visit.
Okay, so like if someone had surgery or just a consultation.
Exactly. Each of those would have a specific CPT code.
Makes sense. But what about the reasons behind those actions? I mean, diagnoses can be pretty complex. How do they get coded?
That's where ICD-10 comes in. Think of it as the code book for diseases, injuries, and health conditions. Everything from a simple fracture to a complicated case of, say, sepsis has its own specific ICD-10 code.
I see. So CPT is for the procedures and ICD-10 is for the diagnoses.
Exactly. Together, they give a complete picture of what happened during a patient's visit, and these codes do more than just billing. They're also used to track public health trends and identify potential disease outbreaks.
That's really interesting. Now, what about HCPCS Level 2? Seems like that one's a bit different.
You could say that. It covers a lot of the other things in healthcare, things that don't fit neatly into CPT or ICD-10.
Like what?
Well, ambulance services, durable medical equipment like wheelchairs and walkers, prosthetics, orthotics, even things like axolotls.
Wait, axolotls, like the salamanders.
Yep. Apparently they're used in some pretty cutting-edge regenerative medicine research.
Wow, I had no idea. So we've got codes for everyday procedures, complex diagnoses, and even futuristic medical stuff. It seems like accuracy would be super important here.
Oh, absolutely. I mean, we're talking about people's health and their finances. Even one little coding error could mean a denied claim, delayed treatment, maybe even an incorrect diagnosis. It's a big deal.
That makes sense. One of the things I was reading mentioned a doctor who was copying and pasting notes from old patient records into new ones. That seems like it would be a problem.
Oh, yeah, definitely. Electronic health records are supposed to make things easier, and in many ways they do, but they can also lead to these sorts of errors. You have to be very careful about data entry.
So it's not just about knowing the codes, but also understanding the whole medical picture, right?
Exactly. And that's why there's this big push for certification in the field. We'll get into that later. For now, let's shift gears and take a look at the billing process itself. How does a claim actually go from a doctor's office to getting paid?
So we've got all these codes that translate medical stuff into something insurance companies can use. But how does a claim actually get paid? Like, what's the step-by-step process?
It's actually a pretty long journey, and it starts right when the patient walks in the door.
Really? So before the doctor even sees them?
Yep, that's when the billing specialists get to work. They're checking insurance coverage, making sure everything's in order, pre-authorizations, co-payments, deductibles, all that stuff.
I guess it makes sense to catch any potential problems early on.
Exactly. It's all about laying the groundwork for a smooth process.
I'm starting to see why organization is so important in this field.
Absolutely. Now, have you heard of those CMS 1500 forms?
Yeah, I saw those mentioned in some of the materials. They seem kind of old school, though.
They are. A lot of places have moved on to electronic systems, but some smaller practices or specialized providers might still use them. It's basically a standardized form with all the key details, who the patient is, who the provider is, what services they got, that kind of thing.
So it's like a snapshot of the whole visit.
Pretty much. But yeah, like you said, most places are going digital these days. They use special billing software to handle everything.
And once the visit is coded, how does the claim actually get sent to the insurance company?
Well, usually it goes through what's called a clearinghouse.
A clearinghouse? What's that?
Think of it like a middleman between the doctor's office and the insurance company. The clearinghouse checks the claim to make sure it's formatted correctly, there are no errors, all that good stuff.
So they're like quality control.
Yeah, exactly. They help things run smoothly and save everyone a lot of headaches. But even then, things can still get tricky.
How so?
Well, there are these things called timely filing requirements, basically deadlines for submitting claims. If you miss the deadline, the claim could get denied.
So billing specialists need to be really good at managing their time.
Oh, yeah, it's a pretty demanding job. And even if a claim is submitted on time and perfectly coded, there's still a chance it could get denied.
Why would that happen?
Lots of reasons. It could be something simple, like a missing piece of information or, a typo in the patient's name. Or it could be something more complicated, like a disagreement over whether a certain procedure was really necessary.
Oh, I see. So it's not always a clear-cut situation.
Nope. And when a claim does get denied, the billing specialist has to figure out why and how to fix it.
So they have to be like detectives.
Yeah, a little bit. Sometimes it just takes a phone call to the insurance company to straighten things out. Other times you need to gather more documentation or even file a formal appeal. It can get pretty involved.
Wow, it sounds complicated. We've been focusing on commercial insurance, but what about Medicare and Medicaid? Do those claims work differently?
They do. Medicare has its own whole set of rules and regulations, being a federal program, lots of paperwork and very specific deadlines.
And Medicaid is run by the states, right?
Right. So there's even more variation there. A billing specialist who works with Medicare and Medicaid really needs to stay up to date on all the latest rules and regulations.
It sounds like a lot to keep track of. With all this complexity and potential for things to go wrong, no wonder certification is so important.
Absolutely. Certification gives you that extra level of credibility and shows employers that you know your stuff.
Okay, so let's talk about that certification process. What are the different ways someone could become a certified medical biller and coder?
Well, there are a few different routes you could take, each with its pros and cons. Some folks like a more traditional classroom setting. Others prefer the flexibility of online learning.
I guess it depends on your learning style and what fits your life. What about community colleges? I know a lot of people start there.
Yeah, community colleges are great. They usually offer really solid programs in medical billing and coding, and they tend to be more affordable than going to a four-year university.
One of the articles mentioned that community colleges are also really good at connecting students with jobs after they graduate. They have all those career resources and stuff.
That's true. And another big plus is that they're usually accredited. That means they meet certain quality standards, which is always good to look for.
Okay, so community colleges offer that more traditional route.
Mm-hmm.
What about those vocational schools or trade schools?
Those are good too, especially if you're looking for a fast-paced program that gets you job ready quickly.
Right, that makes sense if you're eager to jump into the workforce. But I guess they might not cover everything a community college would.
That's possible. You'd want to compare the programs and make sure they cover all the bases.
And then, of course, there's always online programs.
Oh, yeah. Those have gotten really popular. Lots of flexibility. You can learn at your own pace, in your pajamas if you want.
Uh-huh. That's the dream. But are there any downsides to online learning?
Well, you don't get that face-to-face interaction with the instructors and other students. Some people really thrive in a more collaborative learning environment.
I can see that. And it probably takes a lot of discipline to stay on track when you're learning on your own.
Yeah, you got to be self-motivated. And sometimes online programs have hidden costs, textbooks or software you have to buy separately.
Good point. So no matter what route you choose, community college, vocational school, online, it sounds like the key is to do your research and find a program that's a good fit for you.
Exactly. And then once you've got your certification, the adventure really begins. It's time to start the job hunt.
That's right. So where do most medical billing and coding specialists end up working?
Well, hospitals are always a big one. They deal with so many claims, they always need qualified people.
I bet it's fast-paced and pretty demanding.
Oh, for sure. But it's also rewarding to know that you're helping things run smoothly in such an important place.
What about other options?
Well, you've got doctor's offices, clinics, surgery centers, basically any place where medical services are provided.
Wow.
And these days, you can even work remotely.
Really? From home?
Yep. With all the technology we have now, more and more healthcare organizations are embracing remote work. It gives people a lot more flexibility.
I could see how that would be appealing. But do you think you'd miss being around other people?
Some people would, definitely. It depends on your personality. Some people thrive in that social work environment.
Makes sense. So we've got hospitals, doctors' offices, the option to work from home. What about specializing? Can you focus on certain types of coding?
Absolutely. As you get more experience, you might find yourself drawn to a certain area like cardiology or oncology or pediatrics. Then you can really become an expert in those codes.
So you'd be like a specialist within a specialty. What about moving up in your career? What kind of advancement opportunities are out there?
Oh, there are lots of ways to grow. You could move into a management role, supervising a whole team of coders.
I was reading about auditing and compliance positions too. Those seem really important.
They are. Auditors basically check to make sure that all the billing is being done correctly and that everyone's following the rules. And compliance officers, they develop policies and procedures to prevent, fraud and abuse.
So there are lots of different paths you can take depending on what interests you.
Exactly. And the field is always changing, which keeps things interesting. New technologies, new regulations, there's always something new to learn.
Speaking of new stuff, remember how we were talking about ICD-10? Well, I was reading about this new version, ICD-11. What's the deal with that?
Oh, yeah, ICD-11. It's the latest and greatest version of the International Classification of Diseases. The World Health Organization has already adopted it, but the U.S. is still working on making the switch.
I bet that's a huge project.
Oh, it is. We're talking about changing our entire healthcare system, all the computer systems, billing software, everything. But, it's designed to work better with computer-assisted coding.
Computer-assisted coding, what's that?
It's basically using software to help with the coding process. It can make things much faster and more efficient. And some people think ICD-11 is going to really boost the use of this kind of software because the new codes are even more complex and detailed than before.
Wow, so technology is really changing things in this field.
For sure. It's an exciting time to be involved in medical billing and coding, all these advancements on the horizon, and who knows what kind of cool new codes we'll have in the future.
Speaking of cool new things, those axolotls we talked about earlier, that regenerative medicine stuff sounds amazing. Like, could we really see a day when people can regrow limbs?
It's not impossible. I mean, we're not quite there yet. But researchers are making amazing progress. And the fact that there's already a code for axolotls suggests that they're already playing a role in medical research and treatment.
It's crazy to think that a salamander could hold the key to such groundbreaking medical advancements.
It just goes to show you never know where the next big breakthrough will come from. There's always something new to discover in healthcare.
Okay, so we've talked about the codes, the billing process, certification, career paths. This field is definitely complex.
It is, but it's also a crucial part of healthcare. And it's a career with a lot of potential.
With all these new technologies and the demand for qualified people, it seems like a good field to be in.
It is. Now, one thing we haven't touched on yet is the ethical side of things.
Oh, right. That's super important when you're dealing with people's medical records and finances.
Exactly. So let's dive into that a bit.
So we've talked about a lot in this deep dive. All these codes, the billing process, the different certifications.
Yeah, we've covered a lot of ground.
It's definitely clear that medical billing and coding is a pretty vital part of how our whole healthcare system works.
Absolutely.
But with all that responsibility, handling people's medical records and their financial information,
Right.
there's got to be a strong focus on ethics, right?
Absolutely. I mean, medical billing and coding professionals, they're dealing with really sensitive information. You have to be able to handle it all ethically and responsibly.
So what are some of the core ethical principles that guide this profession?
Well, it all starts with honesty and integrity. Medical billers and coders, they have a responsibility to make sure that all the claims they submit are accurate and truthful.
Makes sense.
No inflating charges, no coding for services that weren't actually provided, that kind of thing.
Right. It's about finding that balance, making sure providers are getting paid fairly, but also protecting patients from, being overcharged or billed for things they didn't actually get.
Exactly. And that's where it's so important to really understand the coding guidelines and all the regulations from the insurance payers. It's not just about knowing the codes, it's about applying them ethically.
One of the sources we looked at mentioned a situation where a physician was pressuring a coder to submit codes for a procedure that wasn't actually supported by the patient's medical record.
Yeah.
That seems like a really tough ethical dilemma.
It is, for sure. Situations like that highlight how important it is for coders to have a strong ethical compass and the courage to stand up for what's right.
So what can a coder do if they find themselves in a situation like that?
Well, first of all, it's important to remember that they're not alone. There are resources available to help. Professional organizations, ethics hotlines, places where they can get guidance and support.
Right, that makes sense.
And it's really important to document everything. Keep a clear record of what happened, any communication that took place, all of that.
So it's kind of like covering yourself in a way.
In a way, yes. It's about protecting yourself and making sure there's a record of what happened. And open communication is key, too, both with the healthcare team and with the patient.
Right, keeping everyone in the loop.
Exactly. Patients have a right to understand their medical bills and to ask questions if something doesn't seem right. And coders should be able to explain things clearly and advocate for patients if necessary.
So it's not just about codes and rules, it's also about building trust and making sure the whole billing process is transparent and fair for everyone involved.
Yeah, I think that's really at the heart of ethical medical billing and coding. You're upholding the integrity of the entire healthcare system. You're making sure that patients are getting the care they need without facing unnecessary financial burdens.
So as we wrap up this deep dive into the world of medical billing and coding, what's the one big takeaway you'd want to leave our listeners with?
Well, I'd say that medical billing and coding, it's more than just a job. It's a profession that has a real impact on people's lives.
Yeah, definitely.
It takes a lot of technical expertise, analytical skills, and like we've been talking about, a strong ethical core. And it seems like with all the changes happening in healthcare, all these new technologies, it's going to become even more important in the future.
It does seem like a field with a lot of potential. Well, that's all the time we have for today. Thanks for taking this deep dive with us.
My pleasure. It was great talking about all this.
And to all our listeners, we'll catch you next time on The Deep Dive.